Wonca Europe introduces We Talk, a short talk show-like program where a person of interest is interviewed. Dr. Mehmet Ungan will be the host of the show. Our third guest is Dr. Maria Pilar Astier Peña. She is a Spanish family and community medicine specialist and a preventive medicine and public health specialist from Spain. She belongs to Sem FYC, Spanish Society for Family and Community Medicine, and is the chair of the Patient Safety Working Party of Sem FYC. She works as a frontline family doctor in a primary health center in Zaragoza, Spain. She is an associated professor at the medical school, University of Zaragoza since 2005. She is now applying to become a member at large of Wonca, with a special interest in the position of WHO liaison. This session was recorded on the 9th of November 2021.
Okay, we are all together here, I think, again. Welcome to Wonca Europe We Talk, where a person of interest is interviewed. We thought it would be nice to give a floor to those candidates of executive board of Wonca. Of course, not only the executive board, but also some other colleagues will be hosted here. But now, I think if you have any questions to our executive board candidate, you may here find her that she's ready to answer those. In this Wonca Europe talk, we are very happy to host our colleague, Associate Professor Maria Pilar Astier Peña, who is a candidate for member-at-large position with a special interest into the position of the WHO liaison, which now President-elect candidate Viviana Martinez Bianchi has been working.
Okay.
Maria is a family and community. Maria, can I call you Maria or Maria Pilar?
Maria, if you prefer to do so, it's easier.
Thank you. Maria is a family and community medicine specialist and prevention and also a public health specialist. She has a Master in Science in Public Health, Economics, Health Management, besides Master of Science on Clinical Research. Mm-hmm. She was hospital manager until 2005. Yes. And after that, full-time family doctor in public and rural and urban health cares in Aragon, Spain. And until now, she has been there. She is also an associate professor, medical school, University of Zaragoza since 2005. Professor and mentor of the Family and Community Medical Residency Program of Zaragoza since 2009. You see a lot of hats. Relation with the Wonca, we can just say that member of EQUIP, which I extracted, the European Society of Quality and Safety in Family Practice, the EQUIP, Working Party of Wonca Europe, Chair of the Wonca World Working Group on Quality and Safety since 2016, direct WHO collaboration in the discussions, launching and promoting a global action plan on patient safety 2021-2030. So she's the chair of the Patient Safety Working Group of the Spanish Society for Family and Community Medicine, Sem FYC, since 2012, which is one of our major and biggest community and member organization in Europe. Before starting, I would like to announce to the audience that the duration of each answer is not more than 5 minutes. Otherwise, I will sadly interrupt Maria, and our purpose is to give opportunities to our members to ask as much as they can in a short period, not to be rude. And please ask your questions from the question and answer section. On your right upper side, you will see Q&A section on the right side on your screen. You may upvote existing questions also. We will prioritize the questions with the highest votes as time allows. I will start, Maria. If you want to say a few words, then you're welcome. Then I will ask a question to you to warm up.
Thank you. Thank you very much. First, many thanks to the Wonca Europe board for giving me the opportunity to participate in this event. it's a great opportunity for me to share the motivation of my candidacy as a Wonca member at large in this point of my life, personal and professional, and an opportunity to listen to the needs and expectations of the members of Wonca Europe in relation to what they expect from the member at large Wonca world, if I'm elected, finally.
Yeah. Now I just curious about something. Then I have to ask it, Maria, in front of other colleagues. Um, Maria is a public health specialist, a specialist in family doctor as a family doctor, and practicing as a family doctor, an academician, and a warrior of quality and safety, besides being a mother of 2 girls and a boy, in total 3.
Three.
So she's a woman. There is a saying in many languages like holding more than one watermelon in one hand, like a magician, you know? And you want to add one more watermelon. Will you be able to carry such a space occupying work in addition to your old position? And why you do that?
Okay, thank you. This is a challenging question, but well, I think that all of us in our lives, we are in some way jugglers, and the most important skill to do to perform an amazing work is working with full attention or with mindfulness. So to keep all the ball in the air, incorporating new ones and throwing others. So this mindfulness, I try to practice every day. And when I work in everything, I try to be full attention and searching which balls are going to keep in the harmonized performance and what to throw out. So perhaps I can explain a bit which things are going to be in movement. Well, as a family doctor, I think now I have acquired a great ability just visiting patients. And now we visit an average of 40 to 50 patients per day with 80% face-to-face visits already. At the same time, I have a family resident, Ines, that helped me in the office. And as well, Diego is a medical student with me in the practice. We all together try to practice full attention to our patients, and at the same time of the practice, I chair the patient safety group, as you say, and the quality and safety Wonca World working party. But in this moment, after 4 years of chairing this Wonca World group, I take over to a new chair, that is Dr. Chema Valderas, which I think it would be a wonderful and extraordinary chair for the Wonca Working Party, with the continuity of Jose Miguel Bueno, who will help to go on with the working started. So I have the experience of working with a World Health Organization during these 4 years. So I acquire quite a bit good relationship with them and with the main project they are developing, in which they consider Wonca and my personal participation as chair of the Wonca Working Party to highlight the special role of primary care in the development of different initiatives, particularly this Global Action Plan on Patient Safety, which is the role of a strong, quality and safe primary care. And regarding the personal perspective, well, my children have grown up, and now one is my eldest daughter is Leticia, and she is an internal medicine resident in a hospital in Barcelona. Lucia is working as an early childhood teacher in Helsinki, in Finland, and Juan, he's studying as physiotherapist and physical trainer in Lleida, that is a province near Zaragoza. So they are all starting their new lives. So I think I will get some time for this position as well from my family, but they also need some help, this time by phone, I think.
Yeah, Maria, you seem very young, so that's the reason I asked that question to you. But I was not aware that you already emptied some space from your life. Of course, mothers are always occupying with their children in their hearts, but also you have spare time to work for us,
Yes.
to advocate the primary healthcare in everywhere. I think. Shlomo, are you there? If you are there, would you like to ask a question to Maria?
Yes, I'm here. Hi, Maria. Hi,
Hello,
Mehmet.
Shlomo.
What a nice evening. A very good idea to meet all of us. And I see in the
Yes.
chat that we are all not only from Europe, there are
Great.
participants from other places all around. So it's a surprise to me because, we just spread it around Europe, but we are happy that we have some guests from abroad. So all of you are welcome. And I would like to ask you a short question. How do you see the relationship between public health and primary care, and what would you contribute to this relationship?
Well, thank you very much, Shlomo. For me, is my own life because I started as a preventive medicine and public health specialist for the first 15 years of my career. I worked for the World Health Organization European office, my first contract on 95 as a technical advisor on delivering profile of different health systems in Europe. So I work around the different countries in Europe, and I know the work on public health in the ground as controlling outbreaks in my region and doing all the work epidemiologically point of view, and then the work as a family doctor, particularly during this pandemic, where the role of public health and the primary care has been really put on the main picture. I think that we have to try to coordinate, because we do our coordinated work bring us with a better community health. So the key areas are to share health information systems among primary care and public health, to participate in primary care and public health commissioning to improve and the coordination and the plans to optimize one side the information we give to public health and the health organization in primary care. Regarding coding different diseases, regarding reporting compulsory diseases to the public health organizations, and redefining the different steps in the response to a pandemic or to other public health issues. For example, the planetary climate change as heat waves or atmosphere contamination and other issues that may happen along the time. And we had to keep those primary care, family doctors particularly, and public health connected to face these challenges in the future.
Yeah, perfect.
Thank
perfect.
you. Thank you.
Yes, thank you. Maybe I can just continue with one more question, if you allow me.
Okay.
Yeah, can you tell us very simply three most important achievable goals for yourself in that position in the next 3 years, and
Okay.
3 years later, if we are all together in an environment, I will ask you whether you could achieve it or not. Just to remind.
I imagine what's my imagination brings me there in that goal, achievable goal. Okay. Well,
Yeah.
I want to clarify that I think I can best serve Wonca in this position because I bring all my experience of intense collaboration over the last years with the World Health Organization. So this is the main motivation, my previous experience and where I can serve best. And then the key objectives I guess I can help is to represent Wonca and therefore family medicine at the World Health Organization meetings and in the development of plans and programs in which family medicine is involved, especially in relation to quality and safety, because I'm really involved there. But as well to highlight the key role of family doctors in ensuring this quality and safe primary care, guaranteeing the universal sustainable development goals, the universal health coverage. I think this is crucial as well. And then work to improve the coordination, as we said before, between public health and family medicine, highlighting the importance of the work of both in dealing with now the pandemic, but other social issues and climate change issues and environmental issues as well in the global health policy decision making. I think family doctors, as a key element of primary care, will have to be in the boards of health policy decision making to give the perspective of the health of the community, because we are really close to the community. We touch the community. We keep in contact every day with the community. So we can have the ground perspective of the living of the community and what that can moderate and can improve the health policies decision makings.
Yeah, this is covering many things. Thank you very much.
But particularly because of the funding, we have been now living in Europe a lack of funding. No, we are now listen that the European Union is giving an amount of money to countries to recover from COVID. But for example, in my country, there are 0% of this amount, this money for primary care. So this is, I don't know, I think in the rest of Europe is a bit similar, but we have to show numbers, to show the picture, what we have been done during the pandemic, what primary care is doing for the health of the community, and what is essential for investing in primary care. And I think through the World Health Organization, we can push governments to do this investment as well.
Yeah, Maria, just in connection with that, there is a question in our question and answer section. Maybe our colleagues, if they just click on question and answer section, not the chat, see. Jose Miguel asking, and I will try to connect two questions into one question. We can get that. You say that I advocate the empowerment of family medicine and primary care to be a major worldwide contributor to the UN challenge, universal health coverage for all. And your accepted motto is leaving no one behind, like the WHO.
Yes.
So I would just very shortly ask you in practical things, what you will be able to achieve on that, and what are you dreaming? And the second thing is, with that, in connection with that, what is your experience with WHO? Again, can you remind us?
Okay. Regarding not leaving no one behind, and particularly the universal health coverage, and particularly in Europe, because we in Europe, we have as well some areas with people without not covering all the needs. I think the pandemic show us that there are particular areas in which primary care and family doctors will have to work to guarantee this universal health coverage. Many countries have developed policies to get people free charge COVID test, and I think it's really needed. And as well, the primary care approach for those with affected by the pandemic. But we have to increase this minimum services, this minimum basket of services for the whole population in Europe, and of course contributing to the rest of the world. And the second question,
what is the relation? What did you do with WHO? I mean, very shortly, by the way, because I have very good questions after that. I want some time.
Okay. Well, my experience working with the World Health Organization regarding primary care is they are listening, they are accepting our suggestions and putting them on the plans. For example, in the Global Action Plan of Patient Safety, we have directly mentioned in the plan, and we are going to develop a focus deployment of this action plan regarding primary care.
Yeah. And you know him probably, everybody knows. Leo Paz is asking some question to you. And you can read it, and also I will read it. He says that, Dear Maria, several years ago we have challenged form the Wonca SIGFV to integrate a more complex view on safety into working groups on safety, including a full biopsychosocial model to integrate aspects in the evolution of home safety needed for violence. We know that he is really father of violence in Wonka. So he's asking, this has not been tackled. What is your view on that, and how can the biopsychosocial model be more promoted through Wonka? Maybe the last part will be easier to answer. I mean, because it's a very huge question and very correct question, but it will take a lot of time for you.
Yes, well, the biopsychosocial model for primary care, I think we family doctors are practicing every day. I care about the social aspect of my patients and the biological aspect, but as well as for the community. We are now doing social prescription as well. We are doing the community as a healer of the patients. We are working and guaranteeing not only pharmaceutical treatment, but as well social prescribing in the sense of introducing cultural aspect or physical exercise, or suggesting start a conversation in a group, or doing other things that can contribute to improve the health of the community, and considering as well the bio, psycho, and social model of what we family doctors do in primary care, and being an example. So if I'm practicing social prescribing, I'm an example for the rest of the multi-professional team, that they are able to introduce this aspect as well. So we care for the biology, but we care for the psychology as well, and we care for the social perspective of every patient in the community.
Thank you very much. I feel that Leo will have more questions to you, but I don't have time more. But probably he will be in contact with you directly, then you can answer. And
Right.
there is another question from Jean-Pierre. Jean-Pierre is, a very strong French delegation, and also our colleague everywhere, together with us, trying to promote and advocate the primary care. He is asking simply, what will be your position regarding the CME and CPD?
ICP, the International Classification Primary Care.
No, Jean-Pierre is asking about this continuous medical education.
Sorry, because I do not read.
Yeah, don't worry.
CMA, CME, and CPD, because I have read another question about ICPD.
Yeah. Exactly.
Okay, so well, my position about CMA and CPD will be quite connected to the World Health Organization curriculum on patient safety. I'm working on it to develop the curriculum not only in the medical students curriculum, but as well as a competency in family residency, and a competency that we have to develop along our lives, just to guarantee every time, every contact, quality and safer care.
Yeah. So another one coming from Erdem Birgül, who is the maybe the longest consul member of the Wonca Europe, is asking. There is a serious problem of migration of trained family doctors towards more developed countries. The more developed countries tend to open their doors instead of training their own family doctors. Do you think that in any way Wonka can or should intervene in this problem?
Well, I think we have to be prepared to treat and to deal with the problems they bring to our consultation, and we have to do our best without not differences regarding race or gender. So providing an equal healthcare to all, and we have to keep updated.
It's not easy to handle that question, of course, because this is also a political issue with the countries, as I see. But I think that's something he's mentioned that we should be really focusing on as Wonka.
As Wonka, to have a statement on migration, you say?
Doctors, physician migration, because instead of training the family doctors in your country, if you're a rich country, you're asking them to come to your country to practice. It is a kind of ready thing. This is something that should be discussed in Wonka environment. It shouldn't be in silence. It should be really discussed these days.
Okay, but for example, as we are doing with young doctors, that we are doing some exchange, and they come to our. Well, we receive a lot of young family doctors that are doing some placement in Spain to know how primary care is working, and we are informing and presenting them how we deal with patients and how are the flow of the patient and the functioning of the public health system, and then we keep in contact in case they need some more information to implement some ideas in their own countries. So if we do with young family doctors, we are able to do it for the rest of the professionals. We, in the Quality and Safety Family Medicine Working Party, we were thinking to establish a relationship as mentor on quality improvement programs in different areas, and professionals that are more experienced in some countries can help in the development of quality improvement programs in other countries. And we are trying to organize this and to follow the projects along 1 year or 2 years. So we are trying to implement it in the next months. I think there are other questions. We can go just in 2 minutes. What is the role of communication?
Yes, thank you. Can you hear me?
Yes. There is a question about what is the role of the communication skills in the family medicine, in your opinion? Do you use Calgary Cambridge Guide in your own practice? Of course. Well, the Calgary Cambridge Guide is a guide to assess the way we communicate. We try to do with empathy, listen to the patient, reaching agreements with the patient every time they go out of the consultation, just to have the feedback that the patient has already the global vision of what our aim in the care.
Maria, I think we are almost in the end, the last 2 minutes. Okay. And if you allow me to end this, and if you read those questions with you, I think we will take a note. Maybe we can answer later for those questions. I really appreciate and I wish you very good luck in your elections. And we see that you are very ambitious. You are younger than which you are pretending. It is So, so lovely to chat with you. I would wish to have longer and longer talk with you because it's going. Many questions are coming for sure.
Yes.
And I would ask Shlomo, our president, to close this session, and we are with you.
Thank you.
Thank you, Maria, for your excellent speech today and the answer to the questions. I want to thank also the audience that were with us this evening, and special thanks to Mehmet, who is this is his initiative and is running those We Talk webinars very efficiently and very nice. And and wish you success on behalf of myself and Europe. And hope to see you again soon.
Okay, I will still working with EQUIP, the Quality and Safety Group in Europe. I try to push some research in the EGPRN, and of course, I still be a member of Wonca Europe. So independently, if I join the member at large, I will stay with you as well, working.
Thank you.
Thank you.
Thank you very much, both. And bye-bye.
Thank you for participating. Bye-bye.
Thank you to the audience as well. Bye-bye.
Bye-bye.
Thank you for listening. Bye.